Prakoshta Prabhari, Chhattisgarh State, Vishwa Ayurveda Parishad, Joint Secretary for NIMA, Pediatric Society of India, and Zonal Secretary for National Kashyapa Society for Ayurveda Pediatrician. Sir is at present Principal Investigator in Research, which was funded by Government Ayurveda College, Bilaspur, Chhattisgarh. And Sir has completed Health Research Fundamental course, which was organized by ICMR NPTL. Sir has a great mission to establish Ayurveda from student life with a self-running program of Vidyarthi Ayurveda Parichaya Karyakram, having aim of Swasthasya Swasthya Rakshanam and health for all. With this introduction, I request to Vidyabhushan sir to continue the session. Thank you, sir.
Thank you, Sarita madam, for such a nice introduction. Enabling breastfeeding and making a difference for working parents. This is the aim of this breastfeeding week. I'd like to give my gratitude for inviting me on this seminar, Sri Bhushan India Ayurveda Medical College Hospital, Farokhabad, for organizing this type of webinar. And beginning this topic, today I'm going to present my topic as breastfeeding versus prashana and methods of relactation. These are three different topics. I'm going to organize them in a single platform. And yes, the first thing is that you cannot compare breastfeeding benefits with anything. So breastfeeding is always necessary. So versus prashana is not saying not a good thing, but yes, how prashana can benefit you when the breastfeeding is breastfeeding is not constituted or not present with the parents or with the child. So, please next, please. So you can see that right from the birth, breastfeeding is necessary for energy production and various physiological functions, and it is recommended for all infants for exclusive breastfeeding for 6 months. A mother can give the breastfeeding till 2 years of the life, and after 6 months, some complementary foods are also required. A lot of you know this very much. No, any other nutritional method, I have already said, can replace the benefit of breastfeeding. Lehan or prashan can stimulate, enhance, or comply the breastfeeding benefits wherever required. That means as you have all of the Kumar, the people have gone through the yoga and ayog of the lehan or prashan. So you have find that how the acharyas have mentioned where the prashana is required and where it is not. So you can see and you can use this prashana benefits on the places wherever required. And again, comply means that wherever the breastfeeding is less or no breastfeeding is there, the lehan or prashan can provide its own benefits. So this is the fact sheet. All of you know it is very necessary to go through the data. However, it's quite boring to go the data, but I have compared two national family health surveys, that is from 4th to 5th. You can see that first building is about children's under age 3 years breastfed within the first hour of life. You can see that there is very good a change from 4 to 5 data, from 54.9 now to 63.7% increases there. So how much awareness is there about breastfeeding? Everyone is quite aware about the breastfeeding. So it is good change, but still there is no 100% breastfeeding is given in the or are not provided or not being established in the first hour of the life. Next is the how many of the 6 months age baby they take exclusive breastfeeding. You can see that it is only 41.8 to 41.6 from red to blue. You can see that only 0.2% change is there, and many of the children, many of the infants are not getting a proper breastfeeding in this with this important age of the life where the breastfeeding is required exclusively. And you can see the change is also very less. So that is why now going to the next one. So you can see these three things, three plots are also there. So breastfeeding children are receiving adequate diet. That means 6 to 23. That means I have told you that you can provide breastfeeding till 24 months of the life, and how much of the baby are getting proper uh, diet or not. That means those who are not, you can see these figures are very low. That means these children who are above 6 to 24 years of the 6 to 24 months of the life, they are not getting even adequate diet also. So they are highly dependent upon the breastfeeding. So you can see how much breastfeeding is required and how much percentage we are able to provide. Now, this gap can be filled by the prashana because prashana has benefits. I have already told you prashana can stimulate, can enhance or comply the breastfeeding issues also. So this, whatever the gap you are looking here, this can be filled with the help of prashana. So starting from the prashana, Charak has told to give exclusive breastfeeding just after the Jat Karma. What he had told to give in the Jat Karma is to provide Madhu Grat mixed together, and Vagbhatta has added Swarna in it. That means he has given a Swarna Prashan, or you can say exclusive from the birth only. Or if you will say for Charaka, Charaka has given Madhu Grat from the right from the birth only. Prashan of Madhugrat, why there? What is the scientific reason behind it? Is that Madhugrat is a high concentrated osmotic chloride mixture, and it, you all know, you all must be heard about one thing that is called osmotic diarrhea. Whenever you are giving a high osmotic concentrated liquid, it creates a laxative. So, after going through many of the surveys or cross-sectional studies done by the modern side people on the pre-lacteal uses, I have seen that why the people are using this pre-lacteals. It is one of the biggest reason is that it helps in clearing the meconium. That means it creates a laxative atmosphere and help to clear the meconium which is present in the intestinal area. So this negative pressure, this create this, now the bowel is empty. This empty bowel actually creates a negative pressure which causes vigorous suckling and stimulates hypothalamus pituitary axis, which help in establishing lactation. That means it stimulates the hormonal release of prolactin and oxytocin and causes a good lactation. So, and along with that, it gives a proper nutritional benefit also. Use of Anamika finger here, which is said that Angolaya Anamikaya Lehe. That means if the charya or the physician is putting his finger, having this madhu and drak, he can also check the routing reflex along with that. So, if both if you will see during the first newborn examination, you have to see both these reflexes. So, how much our acharyas are known to these reflexes, you can find from this area only. Now, why some differences are there? Like Charaka has told about the use of Madhugrat, and he has told for the exclusive breastfeeding right after the birth. Why it is there? Charaka was a physician. Why this might be possible? He is getting those ladies who are actually multiparous, and their milk, which is coming in their breast, is coming within the 30 minutes of the life. So if there is no surgical intervention, the physiology automatically fills the milk within the 15 to 30 minutes of the life. So Charaka has given this opinion that exclusive breastfeeding should be from the beginning of right from the birth. So next, Madhugrat again. Why the Madhugrat is used? So Madhugrat, both of them stimulates the microbiota of the gut. How they are stimulating? Honey actually having some prebiotics. These are oligosaccharides, and these oligosaccharides actually what they are doing? They are increasing the prebiotic population of the gut, that is the gut microbiota. These microbiotas are lactobacillus and bifidobacterium. These are the good bacteria which are used in the which are these are the good pathogens, which are good bacteria which are present inside your stomach and help in the digestion. Similarly, for the ghee or ghat or clarified butter has butyrate, which is actually very much similar or the same thing which the gut bacteria are releasing, that butyric acid, which help in digestion. So both the honey and ghat, they are both having some scientific values and help help and stimulate that gut microbiota to start the digestion. As the as we are giving this honey and ghat, so they are actually they are doing that, they are clearing the meconium from the GI tract, and second, they are stimulating microbiota to digest the coming breast milk. So how much beneficial madhu and ghat is there, you can see here. So this is the important thing, that quantity of both should be unequal. Okay. Uh, I have seen one of the researches where Dr. Yamini Bhushan has given has done a trial where he has seen an animal trial where he has given the unequal and equal quantities of the madhu and ghat to three groups of the mouse or mice, where he has found that the equal quantity of the ghat and madhu caused falling of the hairs, some skin lesions, and allergic manifestations um, in those animals who have given equal amount of madhu and ghat. But those who have given unequal amount of ghat, they have good good growth of hairs, good their skin luster has increased. Along with that, their immunity is also increased. That means, as the Charaka is already told, that these are the Virodhi Ahar, that means equal amount of the Madhu and Ghat. You have to see, or you have to advise also those physicians who are there, they have to advise you to use unequal amount of the Madhu and Ghat. Okay. Prashana for 3 days. So Shruta has told 3-day regime. He has told Madhugrat and Ananta thrice a day, then Lakshmana Siddhigrat for second and third day, and then Madhugrat in Panital Matra for the third day. Panital Matra, that means Swapanital of that child. So, what is the difference? He's saying he's advising to use Lakshmana, which is actually Apemia saperia, which is the guna of the this Lakshmana is Sar and Guru. That means it stays in the intestine and also causes a laxative effect around itself. So it also helps in laxation. And it is again Balya and Ayushkar in its term. So you can see that use of Lakshmana from the second day, it creates a good atmosphere of Balya and Sara Guna also, so that good, and it is also a rich source of energy. Being a guru, that means it stays inside the alimentary canal also and provide a proper energy which is required for a child who is actually 1 day or 2 day old. Panital matra may correspond to that much amount, as we all of you know that the stomach size of a newborn is 20 ml, and Panital matra allow it for 3 times. It is around 15 ml. So it is that amount which corresponds to the stomach capacity uh, of the baby. So it is this point is need to be investigated more possible. But it's my opinion that Panital matra corresponds to that intake capacity of the stomach. So the delay, why this delay? Why 3-day delay is told by the Sushruta? Sushruta is a surgical related acharya. So those ladies who are actually having surgical intervention, or those who are primary para women, they get their milk in their breast for 48 to 72 hours. So the child needs some of those good nutritious medicine or diets which give them proper nutrition for the 3 days. Okay, so By this, we can understand why there is difference between the both the regimes. And all of you know that Charak has already told that Dhanvantaranam, कि हमको we don't have to go, we don't have to cross our paths. So there may be a good system where those ladies which are with those ladies which are actually uh, those ladies which need surgical intervention, they have been referred to the Sushruta part of the surgery of the medicine. Okay, just बाद में आओ, बाद में आइए, बाद बगल में दिखा लो, सामने दिखा लो. Okay, sorry. So now it is, I hope it is clear that both why there is difference in the opinion. So Lehan and Prashan. Samhita mentioned Lehan as major contributor responsible for the well-being of the newborn. All of you know that this, we are very much familiar with this shloka that Sukham Dukkham is Bahi Balanam Drashyate Lehana Surat. That means Lehan, that means the wealth and happiness of sadness of a baby is related with the Lehana only. So by this, you can see this Lehan is providing energy or providing some nutritious effect in the beginning of the life. Now, various prashanas are mentioned by the different acharyas right from the birth and divided according to the age also or stage of taking food. Now, you can see how Chirat, Chirannad, and Nannad. These are the three divisions, and according to that, acharyas has given uh, different type of the medicine which can be used in the Lehana. Now, Kashyap has focused very much upon the Swarna Prashan, and then he has told at least 4 to 5 medicine which can be used in the same way as the Swarna Prashana, in the Swarna Prashana having the same benefit. Among all, the Swarna Prashana has now created a very much boom all over the India and given very much tremendous results also. But you can see Swarna Prashana, excluding Swarna Prashan, there are some medicines which can also give some beneficial effect with their regular use. I will give a case study related to it. Okay, in the next slides. Next. So Lehana, you all of you know what Lehana, how the Lehana, you have seen how the Lehana is enhancing and stimulating the breastfeeding effect. Now, how the Lehana is complying the breastfeeding effect. Lehana is doing a lock and key factor type of thing. Along with that, you can also say that it is creating fill in the blank type of factor. So you can see that where Lehana is advised. Kshir, Al, Kshir, Dusht, Kshir, those women who actually they are ill, but their children are very good. And Gambhir Rog Purita, that means this is related to the mother only. Then Mahashana, whose child is having a good diet, and Deep Tavini. That means child is good here, but he is not getting adequate nutrition. So if we Vaidyas are able to give a proper medicine which is required to that baby in the Lehana form, it will cause a similar effect which is mentioned here. That means lock and key type of factor effect, and it will comply the breastfeeding effect also. Now, after going through the many scientific evidences, the things which are mentioned in our text, mostly Lehana is advised, then with the Ghat and Madhu, then different drugs are added with these Lehanas, and Swarna Prashan. So I have come. Hello, am I audible? Hello.
Yes, sir, you
Hello.
are audible, sir.
Okay.
Audible, sir.
Okay. I have gone through these effects, these three topics, and seen what type of the research studies are available. So it is very much evident, or you can see the Swarna Prashana has studied very much. from the case report to the systematic review, which is the highest or over the meta-analysis, you can see it has gone through a very extensive investigation or scientific study. However, in compared to the other Swarna Prashana, other lehanas and other drugs are not studied as much. So going to that, which actually, and I have given that period also from 21st, from where I have intimated to give this lecture, from that period to last yesterday, I have gone through this uh, Google search engine. I have found that much of the evidences were present, but mostly studies is the Swarna Prashan. So why Swarna Prashan is getting a boom? This actually most of the time after boom, the people who are related with the scientific background ask from the Vaidyas that do you have any scientific uh, rationale related with the boom of this Swarna Prashan? So yes, some booms are there where which some of the rationales are here, which I'm going to tell you. The Swarna Prashan, why it is used very much, why it is creating a boom. So Swarna Prashan is giving a nanoparticle effect. We are using Swarna in the form of Bhasma, which is around 28 nm of the size, which is average size, which is studied in the X-ray diffraction studies of the Swarna Prashan, where the average size was found is 28 nanometer size, and whatever is below 100 nm is called as nanoparticle. So Swarna Prashan is giving a effect of nanoparticle. So Swarnaprashan exhibits drug delivery effect. How? That means it carries the required drug or the whatever drug which we are giving in Swarnaprashana. That means if Medhajanak effect we want or we want a Balya effect, then Swarna is carrying that drug to the desired site. So Swarnaprashan is also exhibiting a drug delivery effect. So whatever I have highlighted in this text, you can take and search it in the this our scientific Google sites and etc. Google Scholar etc. These all are from the scientific evidences. It do not produces toxic effect also. That means dose dependent manner. It do not give any toxic effect because we are giving a very small dose of the Swarna or that our desired medicine. Absorption starts right from sublingual site into the max and causes maximum blood concentration after 2 hours of the administration. That means right from the sublingual site to the gastrointestinal site, the absorption starts right from the sublingual site only, and that is why after going two pass metabolism from liver and kidney, the blood concentration is maximum in after 2 hours. Now, Swarnaprashan stimulates immune system by enhancing the early maturation of dendritic cells, which are actually very much related or which are the main component of our immune system. Gharat and Madhu provides a colloidal environment where the causes a proper spread of the Swarna particles in the low doses as compared to the high doses. Low doses actually what they are, if you are giving a 250 mg dose and in other group you are giving 30 mg dose, the absorption is very good in the 30 mg dose because it spreads properly in that colloidal environment as compared to the high doses. So low doses give good absorption. So these are those studies where I have shown this. Sir, next please. Sir, next. Next, sir. Okay. So these are those studies where you can find this sublingual absorption in the go in the lower side. Sublingual absorption is maximum in the 2 hours, 0.983. Okay, in the 30 mg, and in the 250 mg, it is after 2 hours, it is very low and very less absorption is there. So it is very clear. In the second picture, you can see this dendritic maturation. Okay, this is dendritic maturation after absorption of this Swarnaprashan. You can see this blue one and this red one. These two cells are there. How? the size of the cell is changed after the absorption of these crystalline SBP, that means Swarna Bhasma particle. So you can see there is very nice scientific evidences that why Swarna Prashan is getting a boom. So now after Swarna Prashan, whether those medicines which are also explained by the Kashyap along with the Swarna, they have also any good effect or not. So these medicines are Satpushpa, Shatavari, Danti, Nagbala, Tivrat, Ekakam, Madhu Sarpibhyam, Medha Jaranam, Abhyase. So whether these also have the similar effect or not. Now I'm going to present a case study. Look here. I have taken Shatavari with it and tried to give a nutritional benefit. However, it is the little Medha Jana. So, but I have used it in nutritional benefit. So, why Shatavari? Because Shatavari is Balya Hriday, Rasayan, Vatahar, Stanya, Kar, and Agni Pushtikar. Now, according to research, it is nutritive action, anti-protozoal action, gastrointestinal activity, and immunomodulatory activities. So, after case presentation, one case of a 6-day-old child was brought in our hospital for vaccination. During his primary examination, we noticed that his weight was 1.70 kgs and his length was 52 centimeter, and the child was looking marasmic and having loose skin fold and history of the high risk to low birth weight baby. Okay. Delivery was performed at home with proper ANC checkup. Attendance belonged to the low socioeconomic background. We have assessed it on the weight for age, height for age, growth velocity, and one ponderal index or the corpulence index, which is weight in gram upon cube of length in centimeter into 1000. So before treatment and after treatment, you can see the effect. This is after 60 days. So growth velocity, which is there, you can see that weight is changed from 1700 grams to 3700 grams, length from 42 to 52 centimeter, and that corpulence index is changed from 22.9 to 26.3, and the velocity of weight, which is 33.3 grams per day. All of you know that maximum velocity of the weight is in the first month, that is 25 grams per day. Then it changed to 15 and then to 10 grams per day. But you can see with this Shatavari Prashan to the child, this velocity has increased much as compared to the scientific evidences which is given. So you can see this by comparing both weight and height after and before treatment. It is very much visible in this pictures also. So after seeing this case study, what I am going to say is that we should not concentrate upon the Swarna Prashan only. We should use all those medicines which are given by the Kashyap and apply on those needy childs who are actually low birth weight, because most of the childs which we are seeing, which Ayurveda people are seeing, they have an average weight of the 2 to 2.5 kg weight. So we can use where the lactation is not proper also, or we want good benefit of the prashana, we can use those medicines in the prashana for the regular use or whatever benefits we want to have. So now relactation. This is also a very much important topic. Relactation, why? Because I have already told that breastfeeding cannot be compared, breastfeeding benefits cannot be compared with the benefits of any other things, whatever complementary feeds we are going to give. Swarna Prashan is for time being, or we can use at adjuvant or to fill the gap, whatever the breastfeeding is creating. But as much as possible, we should concentrate on the thing that a mother should start the breastfeeding again if she is not able to breastfeeding. So there are some definitions which I'm going to discuss. The process by which mother has breastfed earlier and stopped, now want to start again is called relactation. Okay. So establishing lactation means if the gap is only 15 days, okay? Relactation, when the gap is more than 15 days, that means from the establishing lactation to the period of relactation, the definition should be more than 15 days. Lactation and relactation are termed as complete when no top feeding is supplemented. That means top feeding is not given, uh, then only the relactation or lactation is called as complete. It is termed partial when the top milk required is reduced by more than half. That is, whatever we are using, what amount of the breast milk we are using, if it gets reduced, then it is called as complete. And or no top feed is taken, then it is not complete. Otherwise, it is called as half or partial. Then, women who has been pregnant in the past and never been pregnant in the past can also establish lactation, and this is called induced lactation. That means she was not pregnant but was pregnant some years or some years ago. They also can be relactated, and this is termed as induced lactation. So I'm not going in detail for the induced lactation. I'll focus on the relactation only. Conditions of relactation. How the relactation can be established. Okay. Okay, condition of relactation. After the formula milk feeding, why the relactation is required? In which conditions the relactation is required? After the formula or animal milk feeding, the baby has been falling ill frequently. So we need breastfeeding, proper breastfeeding, wherever the baby is not getting proper benefits of the uh, formula milk. So we need breastfeeding. So relactation is required. The baby is not gaining weight and is gaining weight excessively. Either he is gaining weight, either he is gaining less weight or he is gaining more weight as compared or as much is required. Mother who has unavailable earlier and because of ill health or other problems has now been recovered and now she is available. That means she was not available earlier. It may be the both the condition are there. Either she is admitted in the hospital or the baby is also in the ICU and the proper lactation was not established. So there also relactation can be used. Due to frequent social pressure, one lady who is actually have a neonate, she want to restart the breastfeeding. Okay, so mother feels that she needs to develop more emotional bonding with the baby, as the as this our aim of the this breastfeeding week is that making a difference for the working parents. So it is very much related to. Okay, working mothers do not able to produce a proper emotional bonding with the baby. Then after counseling, the mother feels motivated and to start the breastfeeding. After the counseling of the physician, she wants to start or restart the breastfeeding. So these are the conditions which reciprocates to the aim of this breastfeeding week. Here, the relactation is very much required and where the relaxation is advised. Again, what is the basics or the requirement of the relaxation? Relaxation needs sufficient suckling, and sucking reflex is the basic of relaxation. That means a baby who is active for the suckling or his sucking reflex is active, he is advised for the relaxation. Oxytocin and prolactins are the hormone need to be activated for the relactation. That means both the hormones which are required for the lactation, they again are required for the relactation. The basic part is the suckling. Okay. So extra diet, fluid, and rest play a lesser role in the relactation. That means all these things plays. That means if we believe that giving extra diet, fluid, and rest play a good role. So it's a basic thing that they play a lesser role in the relactation. The basic thing is that suckling and these hormones both are very required very much, and all the things which are where the relactation is given, the basic things are these, that is suckling and oxytocin or prolactin hormones. Some drugs in the modern area like metoclopramide, domperidone, and chlorpromazine are also being used for to produce the and to enhance the produced effect. That means they are not directly providing a relactation benefit. However, if they are used, they are enhancing the produced effect. Okay. So how the relactation is giving maximum benefit. So lesser is the gap and younger is the baby, the better is the produced effect, okay, of the relactation. So next, nighttime suckling is very much important. Why nighttime suckling? Because it provides a prolactin reflex. It gives a prolactin reflex at the time if the night suckling is there. It gives a prolactin reflex, uh, which actually uh, produces the good amount of the milk. So this is the algorithm for the relactation, how you can start the relactation in a mother. Mother is advised to wash her hands with soap and water. Okay. Sits comfortably, privately with supportive attendants, keeps the baby on her side, massages her breast, strokes her gently, and stimulates her nipple. I've already told you that suckling is very much important. So this is for the stimulation of the nipple. Ask the attendant hospital to rub her back. So this is an important thing. Why rub her back? Why the rubbing the back of the mother, not the child? Because rubbing the back of the mother when she's going to start the lactation will provide the confidence to the mother and also cause a good blood flow in that thoracic area. And that blood flow helps in filling the milk which is actually produced. Okay, makes baby suckle on the breast and lets artificial milk flow when baby suckles. Okay, so what it is saying that what in the relactation what they are doing actually, they they put the baby on the breast and lets the baby suckle on the breast, and slowly they pour the artificial milk on the areas of the breast, and that goes inside the mouth of the baby, and that the baby feels that that breast milk is coming, and he feeds on the that breast milk. Okay, so this is one of the type of the method. Other methods are also there. Tries and gives a full artificial feed needed by the baby by the above method. So we have to keep the patience, and whatever milk is required, we should give, and we should do it again and again. Repeat the above process every 1.5 to 3 hourly, and at least 10 to 12 times in 24 hours. So you need the parents need a patient along with the physician. So much of the patients to for the relactation. Similarly, those parents who are actually asked to get admitted, that will be more beneficial to produce the desired effect. So it is better to advise them to get admitted in the IPD. Methods. Now three methods are there. Self-assembled model, dropper method, commercially available breast milk, and breast milk supplementers. So three methods are there. Dropper method you have already seen, and one or two methods are also there. So self-assembled method, we are going to see this. For the self-assembled method, a cup bowl of 20 to 50 cc syringe for holding milk is required. You can see it in the picture. This nasogastric tube is also required with its upper end cut, and last side hole is the last side of the nasogastric tube is on the syringe nozzle, and one adhesive plaster is required. Okay, like this, you can see in the picture how this adhesive plaster is required here, how put on the breast of the baby. This actually that artificial milk is prepared in that bowl, and 20 ml syringe was filled with that milk, and then that nasogastric tube from the sides of the neck to the baby's that mother's nipple, at that end is actually is come in the mouth of the baby, and baby starts suckling. So that much pressure which is required is will be caused by the sucking and rooting reflex, and the whatever it is in the milk which is inside that syringe. So that much pressure is created. So this pressure actually creates a proper oxytocin hormone and causes the proper ejection of the milk also. So you can see it like this. This picture is very much clear. This picture is very much clear, and you can see the that breast milk is filled, that prepared milk is filled inside that syringe, and one end of the uh, nasogastric tube, which is filled with the milk, is inside the mouth of the baby. And slowly, if it is not properly suckled by the uh, baby, slowly the milk is given to the inside that nasogastric tube, so that baby gets a proper milk on after suckling also. So slowly and slowly, with the 1 to 2 weeks doing this process, oxytocin and prolactin levels of the mother come in the normal side, and the breast milk start getting produced. So dropper method I have already discussed in the algorithm. You can see in the picture also how the baby can do, how the baby suckles, and by the dropper method he get that milk. So it is better to use that method, self-assemble method, because this, by the dropper method, the milk will spill also on the sides of the mouth also. So it is better to use that self-assemble method. Some commercially available breast milk supplementals are also there, like Medela Supplemental Nursing System, okay, and Lect Aid Nursing System. Okay, these are the pictures you can see. This is the commercially available Medela Supplemental Nursing System and the Select Aid Nursing System. And you can again see that how the main thing is that their last end is inside the mouth of the baby, and the baby suckles on the breast, and slowly when the breast milk start coming inside the breast of the mother, the these systems or this lactate systems are slowly removed. Okay. What are the signs of breast milk coming being produced in the breast? Milk production may start in a few days or a few weeks. What are the signals? Breast changes are there. Mother's breast feel fuller, firmer, and milk leaks and can be expressed. Then less consumption of the supplements are there. That means baby now takes less supplements and continue gaining weight. He do not need that much of the top feed. Then stool changes. Stool changes are also there. The stool becomes softer and like those of the breastfed infants, and whereas the stools of the top feed babies are quite hard. Now, concept of the relictation in Ayurveda, you all of you know that Sukham Dukami Balanam Dhatri Mena and that means Dhatri, concept of the Dhatri is very much known to our acharyas, and because of that, uh, she suckles on the suckling reflex is preserved in the infants, and though Dhatri and Dhatri are used, because of that, suckling reflex is properly preserved in the infants, and that is why relactation is regularly practiced in the ancient time also. The concept of Stanya Vardhan Mahakasha, Stanya Shodhan Mahakasha is also unique, and correct needs helps in correction and increase of the breast milk. Shatavari Methi also increases the breast milk supply, that is increasing prolactin, and the garlic has been found to increase the suckling time of the babies on the breast. That is, they increase the oxytocin. You can see the 2 grams of the use of the 2 grams of fenugreek as a tea thrice in a day helps in proper ejection of the proper production of the milk. This is properly experimented in some articles also present. Garlic, how the garlic So I have quoted this or highlighted is garlic powder transmitted in the breast milk, which may increase the infant suckling time. That is why, and it might enhance the breast infant's food choice of in the long term also. Some other, this experiment was done in the Turkey. So one double-blind trial is also telling about the use of the shatavari in it, oral administration of the research drug, and more than threefold increase of the prolactin hormone. So you can see how much potent our medicines are. Relactation agent mentioned in the Arogya Raksha Kalpadrum. So I have gone through that chapter, which is next. So where the Arogya Raksha Kalpadrum has mentioned some good things which can be used by the mother to increase her milk. That is, one is the shigru leaves prepared in the gharat. So shigru, that is Moringa aloeferea, it is quite common everywhere. And then Kamal Kinjal powder, that is Kamal Nal powder, equal amount of Guduchi powder processed in gharat should be used by the mother. Then use of the Shalishastic rice processed in gharat should be used by the mother. So these three are very common and very easily prepared by the mother, and can be used at least twice a week, will increase the amount of the milk. There should be proper entertainment for the mother, so keep her mind happy. Sadness will decrease the milk production. These are readily available products, alleviate the vitiated doshas, increases the milk supply. Conclusion. No complementary food can replace the advantages of the breast milk. One thing, Leha stimulate, enhance, and complies the breast milk benefits wherever required. Various methods of ration are given in the Samhita. Physician use them in the specified doses in the Leha form. Relactation, where the suckling is a basic requirement, one must try to preserve this by the help of either dhatri or the method of the relactation. That means if you will preserve the suckling, then you can induce the or relactate the mother, and by this you can have the benefits of the breastfeeding. Thank you from my side. Thank you for giving me that opportunity. Dr. Sarita, over to you.
Okay, sir. Thank you so much for your wonderful session on breastfeeding versus prashana and relactation. Very informative session. Now the topic is open for discussion. Participants, please have any doubts, put in the chat box. Sir, we'll wait for 2-3 minutes for the questions.
Yes.
I request to delegates, if anybody have any doubts, they can put in the chat box. Sir, there is one question. Sir?
Yes, ma'am.
Vidya, sir?
Yes, madam. I am audible.
Sir, can you tell use of garlic in increasing breast milk?
Okay. All of you know that in Prashap Samhita, the use of garlic is very much given in the chapter of garlic or Rason Kalpadhyay. So the garlic, how the garlic is actually increasing the breast milk. It is said that if the mother is taking garlic, it goes directly into the breast milk, and its flavor come in the breast milk. Because of that flavor, child like to suckle more on the breast, and reciprocately by increased suckling, this oxytocin and prolactin level get increased, and with the feedback mechanism, this increase of the breast, there is proper increment in the breast milk also. So by this, we can understand how the garlic is increasing the breast milk. That means it is giving flavor to the breast milk along with the additional benefits of the garlic also. Okay.
Sir, is there any specific methods to introduce garlic? Next question is how to introduce it.
Okay, you can use the garlic in the form of, it is also mentioned in the Rason Kalpadhyay that you can use it with proper bharjan and it is not given in much quantity because it is Ushna Vire also. So by 2 to 5 grams per day, it can be used and given to the mother in the Kalp form. Okay.
Okay, sir. So there is one more question. Working ladies who are away from the child for 6 to 8 hours daily, how they can maintain the secretion of breast milk, as this may lead to reduced breast milk secretion. Means time gap
Okay.
is more. So how to maintain that?
So one thing is that she, those who are in the previous lecture, they have also told about the breast milk which is coming. She can express her breast milk. So many methods are there, and she can preserve that breast milk, and then she can use that method of lactation. How they are using, you can see by the nasogastric method also. And if she is having proper breast, their milk in their breast, she can lactate also. So by those ladies who are actually working, they can express milk and they can preserve it also and use it afterward. Okay.
Okay, sir. So one more question. Is the garlic introducing method is also helpful for strong sucking reflex in preterm babies who are less than 28 weeks?
So it is actually common for all the
Its
babies.
garlic method
It
is
not
also
rare.
useful for preterm babies.
You can actually preterm milk is very much different from the term milk. So you can use, however, because whatever the mother nature provides that milk which is required. You can use if it is there. If you find it that it is that mother is not able to produce the preterm milk also properly, you can use these methods. So start from Shatavari first. One thing is that start from Shatavari. If Shatavari alone is not able to work properly, use Shatavari Lehan. Then if both of them are not producing the beneficial result, you can use the garlic.
Hello.
Yes, sir.
Okay, doctor. Okay. All the best for this.
So just another 2 minutes, we will wait for the questions, sir. So many compliments are coming for your session, sir. It
Thank
was
you,
very
madam. Thank you
insightful
very much.
presentation.
Thank you. Actually, I always try to give a clinical side of the things so that we Vaidyas use more and more the textual things in our uh, clinics or our OPDs, so that whatever it is written it should be used practically also.
Yes. So one more question. Is there any time limits for administration of Shatavari or garlic? How many days should be given like that?
Okay, you can use in the form of rasayana. All of you know that Shatavari is used in the form of rasayana. So rasayana methods are also there. You can use it in that form, no issue. This is related to the yukti of the Vaidya also.
Is to till getting desired effect.
Yeah, getting the desired effect. You can as you Chatur Bhadra Kalp Vasti, Ashyap also told about Chatur Bhadra Kalp Vasti. So you can fix a time limit whenever you are getting up, whenever you have start counting that result. You can stop. You can stop that again. You after 7 to 8 days you can start that medication. So it is totally dependent upon the yukti of the Ved. The thing is that there are no clinical trials present for these, much clinical trial present for the Ayurveda thing. So it is, I request to all the PG colleges to start the maximum clinical trial to produce more and more evidence based effects. Thanks.
Sir, there is one more question, sir.
Hi,
Sir, whether Lashona Kshira Paka can be given?
Yes, why not? Why not? De sakte. As many as preparation which are very much palatable to the mother, you can give. No issues.
Sir, there is one more question. If
Yes.
any participants has unmuted themselves, please mute, sir. I request you, please mute. Sir, there is one more question. Use of sagu, that is sabudana preparation, is practiced in many places. Does it really help work, sir?
Sorry, I don't have any information regarding that. You can take my number and afterwards I will go through the Google search and then I will let you know. No issues. I will tell you. I don't have any idea about that.
Okay, sir. Shall we conclude, sir, first session? Okay, thank you so much, sir, for a very informative session, which is really needed. It's a very new topic for many people. On behalf of Sri Babu Singh Jai Singh Ayurveda Medical College, I extend a really hearty thanks to our guest speaker, Dr. Vidya Bhushan Pandey, sir, who spared time from his busy schedule to grace the occasion. Today, we had an opportunity to hear your thoughts, sir. This will surely going to enhance in our future life. Thank you so much, sir.
Thank you very much, madam. Can I leave now?
Yes, sir. Thank you, sir.
Thank you.
Now we'll move on to the last session. Raju, sir, are you there in the meeting, sir?
Yes,
Raju,
I am in
sir?
the meeting. Yes, I am in
Yes,
the
sir.
meeting.
Shall we begin, sir?
1 minute. I will share the day now.
Sir, try, sir, try. Okay, our today last session is from Dr. Raju, sir. Dr. C.M.M. Raju, sir, is going to present on role of breastfeeding in personality development of child. Sir has completed BMS from TMAE Ayurveda College, Bhadravati, under Kuvempu University, and MD Balroga from SDM College of Ayurveda and Hospital Hassan. And sir is presenting PhD. Sir has very vast teaching experience of 18 years for UG and PG. Sir has presented many papers on rationality of Stanya Pariksha in day-to-day practice, Ayurvedic approach to autism spectrum disorder, Ayurveda management on autism in World Ayurveda Congress, which was held in Bangalore. And sir was a resource person in ROTP on Komarabhritya, which was held in a Taranatha Government Ayurveda Medical College, Bellary in 2011. And Government Ayurveda Medical College, Bellary, Karnataka. Sir has participated in many seminars, national and international level. They actively participated in many CME programs, ROTP programs. And sir is having upcoming publications on Tayu Mattu Maguvina Arike, Karnataka 2000. With this, I introduce Dr. Raju sir for the presentation. Sir, you can proceed the sessions.
Yes. The screen is sharing. My voice
Yes,
is
sir. Your
audible.
screen is visible. Make it slideshow, sir.
Okay, 1 minute. Now is it correct?
Yes, sir.
Okay. One minute. So my topic is role of 1 minute. Now go. Now go.
Yes, sir. You are audible.
Maybe the sharing ಹಿಂಗೆ ಬರುತ್ತೆ ಅನ್ಸುತ್ತೆ. ಈ ಕೆಳಗೆ access ಮಾಡಿ
Hello, sir.
Okay.
Sir.
Are you audible now, madam?
Yes, sir. You are audible, and screen is also visible.
Okay. So my topic is about role of. Thank you for introduction, madam. Dr. Sarita, madam, and Dr. Srinivas are giving opportunity to present topic of the role of breastfeeding in personality development of child. So it is first we can understand what is personality and what is personality development. So personality is a characteristic way of thinking, feeling, and behaving. There is a definition of University of Illinois. Personality, it is a total element, thinking and feeling and behaving. So somewhat difficult and it's very, uh, it is not so easy to tell. It is only breastfeeding helpful all these things. But I am trying to correlate with breastfeeding may be the helpful for all this thinking and feeling and behaving. Breastfeeding impacts children's brain, cognitive and social emotional development. And that is the World Health Organization and American Academy of Pediatrics recommend at least 6 months of exclusive breastfeeding, which is defined by breast milk as the only source of sustenance. It is telling that at least you have to give for 6 months breastfeeding. It is more helpful for the development of the brain and cognitive and social emotional development. And breastfeeding is not simply meal at the breast, but also significant and far-reaching effect on the cognition, behavior, and mental health in children and mothers. It is not considered only as a meal. It is a effect in cognition, behavior, and mental health in children and mothers. Some of the research work I took for the all this, and it is especially on the so many research work on done on the how the personality development is helpful. So some of the heading I will taking for the considering to development for the personality development. One is the breastfeeding and cognitive outcome in children, breastfeeding and brain development in children, breastfeeding and social and emotional development in children. So breastfeeding and cognitive outcome in children. So some of the research from different countries providing evidence for a link between breastfeeding experience and cognitive development later in life, including improved memory retention, greater language skills, and intelligence. The association between duration and breastfeeding and adult intelligence is this. In these studies, they studied design for the is a cohort studies, a sample of 973 men and women, and a sample of 2,280 men was studied in 1959 and December 1961. So these studies done between the intelligence assessed using the Wessler Adult Intelligence Scale (WAIS). It is a to understand there is a by giving the breastfeeding. So they will studies the results they're telling about if it is a giving a duration less than 1 month or 2 to 3 months or 4 to 6 months or 7 to 9 months and more than 9 months. What is the result? The corresponding mean score is telling about that. If it is a giving 1 month, that is a 38 scoring. If it is a giving 2 to 3 months, it is a 39.2 scoring and 39.9 scoring and 40.1 and 40.1. The conclusion is independent of wide range of possible of co- confounding factors. A significant positive association between duration of the breastfeeding and intelligence was observed in independent samples of young adults assigned with two different intelligence tests. It is a telling about that by giving the breast milk for the 6 months, it is a definitely helpful for the there is a development of a cognitive and that is helpful for the increasing their intelligence also. And there is another studies that tell you about long-term health outcome and mechanism associated with breastfeeding. It is in human milk may show a reduced occurrence of disease because of the babbling evolution, promote survival, and because of specific factors in milk that promote active stimulation of the infant immune system and gastrointestinal mucosal maturation, decreases the incidence of infection and alter the gut microflora. by giving the long durations of a breast milk. Definitely, it is helpful for the development. There is a alter the gut of a microfolia, and it is a helpful for the repeated disorders. It may be the reduces, and by doing the by this, there is a development is a proper growth and development happens. And breastfeeding and child cognitive development, new evidence from a large randomized trial test. There is a one random randomized trial test. This is they are doing on the December 21 and 2002 and to April 27 to 2005. There is a using for the evidence that breastfeeding improves the cognitive development is based almost entirely on observation studies in this prone to confounding the subtle behavioral difference in the breastfeeding mother's behavior or an interaction with the infants. So it is a results telling about that the examined intervention lead to the large increase in exclusive breastfeeding at the age of 3 months. So and the significantly higher prevalence of any breastfeeding at all the ages up to the including 12 months. The experimental group and add a higher means and on all the there is a once again they are using for the intelligence measures with the cluster adjusted mean difference 95% in confidence intervals. So here conclusion about that these results based on the largest randomized trial ever conducted in the area of human lactation provide strong evidence that prolonged and exclusive breastfeeding improves child cognitive development. Here the studies using for the participant is total is a 17,046 healthy breastfeeding infants were enrolled and a womb of the 13,899 were followed by the age of 65 years. And the next is the breastfeeding long chain polyunsaturated fatty acid in colostrum and infant mental development. So usually in the colostrum they present of long chain polyunsaturated fatty acid is there. That how it is helpful for the development of the infant mental development. Well, objectively assessed the role of parental psychological factors and colostrum long chain polyunsaturated fatty acid levels in the relationship with breastfeeding and children neurodevelopment. The method used is a population-based birth cohort was established in the city of Sabdell. There is a cohort studies in the one particular area and for the long duration as a part of a there is a INMA and a medio ambience project. A total 657 women were recruited during the first trimester of pregnancy. Information about parental characteristics and breastfeeding was obtained by using a questionnaires and trained psychologists assessed mental and psychomotor development by using a Belly Lily scales of infant development in a 504 children at 14 months of age. This method they are using and the conclusion about for these studies is a greater level of accumulated breastfeeding during the first year of life or related to the higher mental development at 14 months, largely independently from the wide range of the parental psychological factors. The another studies too helpful for the understanding of cognitive improvement by the breastfeeding. That is a cohort study in the full breastfeeding and child neurophysiological, neuropsychological development, the role of maternal, social, and psychological and nutritional factors. In this method, they using the participant in this studies for a population birth of cohort in the city of Sabdell. The female were recruited during the first trimester of pregnancy between July 2004 and July 2006. Information about parental characteristics and breastfeeding was obtained through the questionnaires. Full breastfeeding was categorized as a never short term and long term or a very long term. A trained psychologist assigned the neuropsychological development of children at 4 years of age, using with The scale is a McCarthy scales in children's abilities. So here also the interpretation about these studies is a very long-term full breastfeeding was independently associated with a neuropsychological function of children at 4 years of age. Maternal indicators of intelligence, psychopathology, and cholesterol N3 fatty acid did not explain this association. Here they are telling about the development of a psychological and mainly it is helpful for the nutritional factor also. By this, all this they are telling about that this raises the question of what mechanism underpins these effects of breastfeeding on a cognitive development. One possible mechanism.
You take that. So now you are not on any allopathic medicine. Only
One possible mechanism may related to the specific nutrients such as a long chain polyunsaturated fatty acid, which are present in human milk but usually absent in a formula. Say LCPUFA, it is a which are present in human milk but usually absent in a formula milk. The two major are they for first one is a DHA and a ARA. Arco. It is a which are involved in the neurodevelopment by contributing to healthy neuronal growth and repair and myelination. These two factors major helpful for the development of a repair, that is a healthy neuronal growth and repair and myelination. Importantly, myelination predominantly occurs postnatally within the first 18 months of life of infant. Produce a small quantity of DHA during the first 2 weeks of life, but are then unable to produce sufficient amount on their own until about 6 months of age. This suggests that possibility of window in a development during which human brain and cognitive development may be particularly sensitive to say long chain polyunsaturated fatty acids supplied through the breastfeeding. This is mainly important that LCPUFAS is very important for the development of the brain growth development and for the intelligence also. Next, another one is a point I am taking about for the person that is a important for the normal that is a breastfeeding and brain development children. So in this studies they did for the EEG and MRI after giving the breast milk. The research into the potential impact of breastfeeding on brain development complaints and extends work on a cognitive development by using methodologies such as a EEG and MRI. In the studies, they're telling about one such study measured EEG spectral power longitudinal over the course of the first year of life in a group of typically developing infants and compared between breastfeed and formula feed infants. They compared with giving formula feed infants and also compared with the breastfeed infants. These studies show that within the frequency range thought to be most impacted by the myelination and formula feed infant is displayed earlier peak at 6 months than breastfeed infants at 9 months. In EEG power measured in this frequency range followed by decline with age seen in the both groups. These studies suggest that breastfeeding influences the timing of myelination process in the developing infant brain by prolonging the peak of myelination to a later age. This shows that it is a breastfeeding is more helpful for the development of a prolonging and a peak of myelination at later age. While the authors of these studies make no strong claims regarding the benefit of breastfeeding, they suggest that these different patterns of early neuron development may be set of a different trajectories in brain and cognitive development between the breastfeed and formula feed infants. For to confirm all this, there are studies about the longitudinal study of difference in EEG among breastfeed milk formula feed and soya formula feed infants during the first year of life. There is a aim to compare the effect of major infant diets in the development of brain electrical activity during the infancy. The study design is a scalp EEG designs 124 sites recording from the same infants during the quite wakefulness of the 3, 6, 9, and 12 months. In subject, there is a LP full-term infants, 40 per group, gender matched, either breastfeed or fed milk formula or soya formula through the first 6 months. There is a conclusion that development of brain electrical activity during the infant differs between those who are breastfeed compared with those fed either milk or a soya formula, but is generally similar for a formula fed groups. This variation in EEG activity reflects a diet-related influence on the development of brain structures and functions that cloud- could put infants on different neuromotor, neurodevelopmental trajectories along with the cognitive and brain functions development will processor. And further, there are studies employing structural and diffusion weighted MRI critically complement and extended the above mentioned findings by directly measuring difference in the brain structure. In line with the finding, the breastfeeding infant, timing of myelination, whole brain volume, cortical thickness, and white matter volume have all been found to be increased among children with a longer duration of breastfeeding experience. So further studies they will help for these findings regarding brain development suggest that elements of breast milk itself, particularly long chain polyunsaturated fatty acids, likely contribute to enhance the pattern of the myelination in the developing of brain, but they do not fully account for the reported effects of breastfeeding on brain development. Therefore, there must be additional factors that contribute to the seen effect of breastfeeding. Such factors could potentially be aspects of the interaction between mother and the infant, such as a touch and warmth, other substances contained in the breast milk, such as hormones that are not present in a formula. Not only it is a giving breast milk to development of the brain, that is also it is important that that is a touch and warmth and they very important that the bondness of the mother is also very important to development of the brain also. And next is breastfeeding and social and emotional development in children. In addition to the effect report the children's cognitive and brain development, there is evidence that breastfeeding also impacts social and emotional development in children. Similar negative temperaments such as fussiness has also been found to be associated with the prolonged duration of breastfeeding in infancy. It is one thing that is more than negative means it is considered for the more than 6 months or maybe 9 months or more than 1.5 to 2 years. If it is also negative prolonged duration of giving breastfeeding causes fussiness. In contrast, another study found that breastfeed infants were reported to have a more vigor at 3 months of age. Vigor means that is a healthy and healthy development of the body, characterized by a greater approach and activity than formula fed infants. Thus, the evidence concerning the association between breastfeeding is mixed and may depend on the specific temperament characteristics examined. There is also research indicating negative association between breastfeeding experience and aggressive behavior. For example, duration of breastfeeding experience has been shown to correlate negatively with parent-reported antisocial and aggressive behavior in children from 4 to 11 years of age. In this, they are telling about if it is not giving breastfeeding, it may be the cause some of the antisocial and aggressive behavior also. And next further, there are studies the same that telling about there is a accumulating evidence to suggest that absence or a short duration of exclusive breastfeeding might be associated with the development of autism spectrum disorder, a neurodevelopmental disorder characterized by social impairment. Here, the telling about not about for the speech or anything, that is telling about for the social impairment, neurodevelopmental disorder characterized by the social impairment. Recent meta-analysis of over 2,000 children report that those diagnosed with the ASD were significantly less likely to have been breastfed than a neurotypical children. There is a less breastfeeding than the other children. Further, it has been a report that children with over 6 months of exclusive breastfeeding are a formula supplemented with the DHA exhibit the lowest probability for subsequently being diagnosed with the ASD. What is a 6 month of breastfeeding is a less diagnosed of the ASD. Here they like breastfeeding and infant temperament at the age of 3 months. There's one study is there to examine the relationship between breastfeeding and maternal rated infant temperament at the age of 3 months. Using 316 infants and in the prospective Cambridge baby growth study, UK had infant temperament assessed at the age of 3 months by mothers using the revised infant behavior questionnaires, which produced scores for three main dimensions of a temperament derived from a 14 subscale. Infant temperament score were related to the mode of infant milk feeding at the age of 3 months. Breast only, formula milk only, or mixed, with adjustment for the infant age assessment and index of deprivations. Here there is a result or conclusion about that breast and mixed fed infants were rated by their mothers as having a more challenging temperament in all three dimensions. Particular subscales include greater distress, less smiling, laughing, and vocalizations, lower sociability, increased awareness of behavioral dynamics of breastfeeding, a better expectation of a normal infant temperament, and support to cope up with the difficult infant temperament could potentially help to promote a successful breastfeeding. By giving the breastfeeding, telling about that greater, there is a laughing, vocalization, and a lower suitability. And next is using genetically informative design to explain the relationship between breastfeeding and childhood conduct problems. Here, this study aimed to examine whether there is an association between breastfeeding and later conduct problems in children. It also considered the extent to which any relationship is attributed to maternally provided inherited characteristics that influence both likelihood of a breastfeeding and child conducted problems. Here, the studies has a cross fostering design with a sample of 870 families. Child aged 4 to 11 years were used. Here, there is a mothers were genetically related to the unrelated to their child as a result associated with reproductive technologies. The relationship between the breastfeeding and the conduct problems was assessed while controlling for a theorized measured confounder by multivariate regressions, maternal smoking, education, and antisocial behavior, and for unmeasured inverted factors by testing associated separately for related to and unrelated mother-child pairs. Breastfeeding was associated with lower levels of conduct disorder symptoms in offspring in the middle childhood. Breastfeeding was associated with lower levels of conductive problems even after controlling for observed con- confounders in the genetically related group, but not in a genetically unrelated group. In contrast, maternal antisocial behavior showed a robust association with child conduct problems after controlling for a measured and inherited confounders. These findings highlight the importance of using genetically sensitive designs in order to test casual environmental influences. And another studies that telling about maternal breastfeeding and autism spectrum disorders in children, a systemic review in the meta-analysis. Here mainly the studies about for the ASD. Here this objective is that to refer to group of ASD refer to group of condition variable affecting communicative and social interactive abilities present alongside behaviors with various restricted and repetitive patterns. In addition to genetic factors that influence the onset of symptoms, there is a growing interest in the potential involvement of non-genetic and environmental factors. Some aspect of breastfeeding practices, including rates, timings, and optimality, have been put forward as environmental risk factors for autism. Our previous studies show the controversial relationship between ASD and breastfeeding. Here, the method is using a meta-analysis on the association between the maternal breastfeeding and ASD. In children was conducted, we also explored potential moderating factors which might influence with this association. Articles reporting association between breastfeeding and diagnosis of ASD were included. In this discussion, the telling about that a meta-analysis provides evidence that breastfeeding, exclusively or including additional supplements, may protect against ASD. Prospective longitudinal research is required. Here, the telling about the need longitudinal research, the complex relationship, and to explore potential and pathophysiological mechanism to understand. The breastfeeding infant formula supplement and autistic disorder, result of a parent survey. Here the method using this is a case control study using the data from autism spectrum, autism internet research survey, and online parental survey conducted from February-April 2005 with result of 861 children with autistic disorders and 123 control children. The analysis were performed using the logistic regression. There is a conclusion that results of this preliminary study indicated that children who were not breastfed or were fed infant formula without, that is a DNA and ARA supplementation, was significantly more likely to have autistic disorders. There is a considering the effect of breastfeeding on child in cognitive and social and brain development. All this, there is in general, breastfeeding experience has been associated with improved cognitive abilities, facilitated brain development, and a reduced risk of antisocial behavior and atypical social development, including ASD. However, there are several issues to keep in mind when considering this line of research. With respect to those underlying the mechanism, we would like to briefly outline a working model as to how breastfeeding impacts child development. Based on this research, therefore we suggest the following two key processes to account for cognitive development benefits and social development benefits as they are related to breastfeeding. There is a long chain polyunsaturated fatty acid contained in human breast milk critically contribute to the white matter development during the childhood, which accounts for improved cognitive and intellectual functioning. In oxytocin contained in human breast milk and further released during the breastfeeding through suckling, touch, and warmth facilitates social emotional functioning in the infant by enhancing positive tendencies and reducing negative tendencies. This likely accounts for improved social development and reduced antisocial and atypical social behavior. These are two very important. By breastfeeding, there is a helpful for the development of the cognitive development benefits and the social development benefits. By these two understanding, there is a LCPUFA and DHA and IRA. Source is the breast milk and the genetic variation. Proposed methods neuronal growth and repair and myelination. If it is the content of LCPFA is more in a breast milk, it is a development of neuronal growth and repair and myelination. This outcome, what is the extended rate of a duration of myelination, increased whole brain volume and cortical thickness, and increased white matter volume and heightened cognitive performance, the IQ executive functions. By oxytocin, breast milk endogenous releases due to touch, warmth, and eye contact during social interaction and genetic variations. This the facilities of social and perception, personal behavior, bonding, anaxiolytic effects, and interaction with other hormones and neurotransmitter system. The heightened attention to positive emotional expression, reduced antisocial and aggressive behavior, reduced likelihood of a ASD diagnosis. By these two helpful for the development, personality development of a giving a minimum of a 6 months of a breastfeeding and maximum we can give for the model, but it is by word the World Health Organization telling about you have to give for the 6 months, continuous 6 months. It is helpful for the all this personality development. And this about to complete. Any doubts, any questions you can ask me.
Thank you so much, sir, for providing database on the relation between the breastfeeding and the personality development of child. Now the topic is open for discussion. Delegates, if anybody is having any query, they can put in the chat box. I request to delegates, if anybody have any doubts, they can unmute themselves and ask directly to the sir also. So another 1-2 minutes, we will wait for the questions, then we will conclude the session. So there is one question that
Ah.
how to manage breastfeeding related behavioral problems in children?
So actually, those who are giving for the breast milk for the minimum 6 months, and they tell in India they'll give up to it is a 1 year up to 2 years they're giving breast milk. So management by giving the breast milk for the long duration, they're telling about minimum 6 months, and the maximum we can give for 6 months by World Health Organizations, and we can continue that also. It is a gut flora may be the helpful for the there's a development of a person. There is a any behavioral issues. Usually in the autism spectrum disorders, the direct relations with gut along with sexual disorders. If we are correcting the gut issues, so what we are giving the results by giving the medicines of a Shivagutika or maybe the any digestive, the improvement for gut, improvement of any infective issues in the gut to clear that one. It is a hyperactivity and behavioral issues is reduced to what I am seeing my practice. So better to give for the first concentration on what for the gut issues in the autism disorders and behavioral disorders also. And also I am seeing that if it is a child is giving taking too much of a oily food or there's a deep fried foods, maybe the increases of their behavioral issues. So if it is stop also, sometimes they'll help for the concentration and they'll observation of a also improve. So better to avoid all this and give for the if it is a continuation for the breast milk for the 6 months and up to 1.5 to 2 years. Definitely you can see for the children they'll less suffering of a behavioral disorder.
Thank you, sir. There is one more question. If the child is not at all cooperative during feeding, is there any developmental issue in the child?
Usually it is a seen in that normally if it is not cooperative and if it is not taking proper breast milk, some of the issues definitely develops later in life. But the minimal you can observing that for the they'll aggressiveness or maybe they'll not listening the words of the parents. This may be the present later in life. By study or data, they're telling about that if you give the breast milk, this behavior is definitely reduced.
Thank you, sir. So on behalf of Sri Babu Singh Medical College and Hospital Farokhabad, I sincerely thank to our guest speaker, Dr. Raju CM sir, for taking his time and gracing this occasion and sharing the valuable knowledge on relation between the personality development of child and breastfeeding with the huge data. Thank you so much, sir. Now we come to the end of the session.
And once
I,
again, sir,
Dr.
thanks.
Sarita S. Nirikeri,
Once again, thanks, Sarita madam, and
Department of Balaroga. Thank you so much, sir. Concludatory comments. I, Dr. Sarita, School Fraternity, Singh Jaising Ayurveda Medical College and Hospital Farokhabad, would like to thank our dignitaries and all the eminent guest speakers who readily agreed our invitation and share their for the Bala Jeevanam 2020. I would like to thank a sincere gratitude and Director Dr. Sunita Yadav Madam and Principal Sir Dr. G.K. Srinivas being our backbone to conduct this webinar. Thank you so much, sir. And our college Prabodhini team for providing digital platform to conduct this webinar. Thank you so much for the webinar, Prabodhini team. Let us give applause and heartfelt appreciation to all the delegates who contributed to making this webinar success. Finally, I would like to convey my gratitude to everyone here making us today and for assisting us making this webinar a huge success. Thank you to every one of you. Thank you so much. Namaste to all. To conclude the national webinar, shall we go with the national anthem?
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thanks to all, and certificates will be very soon distributed to all the delegates. Thank you so much for active participation. Now the